Basic principle of pharmacy, prescription, labeling, and Latin terms. The prescription is a pre-printed document, can be handwritten or computer printed, meaning pre means before and script means written. Prescription. Pre means before, scription means written. Refer to the fact that the prescription is an order that must be written down before a compound drug can be prepared. Refer to the fact برمیگرده به این حقیقت که prescription is an order that must be written down before a compound drug can be prepared. The prescription is a regulated communication between the prescriber and the pharmacist. The prescription is a written order for compounding, dispensing, and administering drugs to a specific clients or patients. Once signed by the physician, it becomes a legal document. Once signed by the physician, it becomes a legal document. Contents and the formats of the prescription. Identification of the document. Identifies the document as a prescription code and numbers. Time limit and term recipe is a synonym with command take. Identification of the document. Identify the document as a prescription code, it has or not, it has a number or not, it has a time limit for 3 months, and the term recipe is synonym with command take. Identification of the prescriber. Name and address of the prescribing provider. It should have a name and address of the prescribing provider, registration number of prescriber, and signature. Identification of the patient. Name of the patient, address, age, signature. Identification of the drugs and its use. Preparation, dosing, use. The pharmacist is instructed to label the medication. Instruction on whether the prescriber will allow the pharmacist to substitute a generic version of the drug. Instruction on whether the prescriber will allow the pharmacist to substitute a generic version of the drug or not. که همون لغت چی بود؟ هلنزیش، مربع هلنزیش. Parts of the medication prescription. Main section. Superscription. Superscription is the heading where the symbol RX, an abbreviation for recipe, the Latin for take two, is found. Superscription it has a symbol of the RX or recipe or the Latin name of take two is found. Inscription. Inscription is the body of the prescription, name and quantity of the chief ingredients of the prescription and the dosage for. Inscription is the body of prescription. Superscription is the heading where the symbol RX is there. Inscription is the body, name and quantity of the drug. Subscription gives a specific direction for the pharmacist on how to compound the medication, in Latin usually. Subscription gives the specific direction for the pharmacist on how to compound the medication, in Latin usually. Signatura or transcription gives instruction to the patients on how and how much and when and how long the drug is to be taken. Superscription, inscription, subscription, signatura or transcription. Subscription for the pharmacist and transcription and signatura for the patients to how much, when and how long the drug is to be taken. Name of the prescriber, date, patient information is followed by the superscription, which is followed by the inscription. Then the subscription, next follows the signatura. Patient's information is followed by the superscription, which is followed by the inscription. Then the subscription, next follows the signature. نه همه ترتیب داره. Okay. American prescription is look like this. It has a prescriber information, patient information, date of the prescription, superscription RX, the subscription or body of that, inscription, is
inscription به لاتین می‌نویسن.
inscription in Latin but in American it look like ایران هم همین جوریه. medication prescribed, signature or transcription for the patients, a special instruction and signature of the doctor. Hungarian prescription, identification of prescriber, Dr. András Filter, Department of Pharmaceutics, identification of the patient, again Fittler András. Okay. It was a barcode. We understand that this is a birth date. Okay, this is NE is a Hungarian insurance number. EU is a European insurance number. Here it's identification of patients, superscription, recipe, RP or RX, inscription, body of that, subscription is for the pharmacies, scatulum originalum numero unum, and signatura is for the patients. Validity, stamp and signature of the doctor. Date of prescribing expiry is in 19 days or 3 months here. Helhezes is here for the substitution to the generic drug is allowed or not, and these are the insurance, different insurance, full subsidy, no subsidy, partial subsidy. Okay, accuracy is emphasized by Roman symbol and Arabic number. Accuracy should be emphasized by Roman symbol and Arabic number. Roman, Arabic. بعد همین دیگه. Identification of the patient, patient signature, doctor signature. NHS prescription in the UK is look like this. جالبه ها. Errors occur and errors can be fatal. Most errors can be corrected, only prevented. Most errors can be corrected, only prevented. It's a great responsibility of the pharmacist. Prevention method. Constant checking, double check regularly. Stop if you are uncertain about something. Constant checking, double check regularly. Stop if you are uncertain about something. Practice procedures. Set up your own personal procedures. Try to do a process always similarly. Try to avoid distracting یعنی حواس پرتی. Try to avoid distraction. من distraction رو قبلا چون رفت کرده بودم، تراکت ها هستن و تراکت ها وقتی باد میخورن حواست ما رو پرت میکنن. distraction. Concentrate only on one thing, on the patient, just on the patient. If you are nervous or excited, slow down or rest. Okay, prevention method. Constant checking, practice procedure, set up your own and personal procedures, try to do the process always similarly, and try to avoid distraction. Pharmacy practice procedure. Read the prescription, find out information, think, and carry out the procedure. Act. Read, think, act. What is the pharmacy practice procedure? Read, think, act. Read the prescription, find out information, and carry out procedures. Procedures for checking prescription. Read the prescription. Is the prescription legal? Who is it for? برای کیه? Name of the preparation. What quantity is to be dispensed and instruction for the patients. Find out information and carry out the procedures. Find out information. What is it? How does it act? How is it used? Are the prescriber instruction is correct? How is it prepared? What advice does the patient require? Carry out the procedures, make the preparation, pack into the appropriate container, label the container, hand over to the patients, give the appropriate advice, and archive the prescription. یه بار دیگه من ریدا بخونم. Is the preparation legal? Who is it for? Name of the preparation. What quantity is to be dispensed? And instruction for the for the patients. Handling of the prescription by the pharmacist. Pharmacists may write certain information right on the prescription. Write the date the medication was dispensed. Pharmacists should sign the prescription. In the American, dosing information is printed onto label and the label affixed write onto the prescription. اینجا هم همین کار میکنن که dosing information by the label should چیز بشه، منگنه بشه به چیز. Dosing information is printed onto label and the label affixed right onto the prescription. As a legal document, some jurisdiction mandate the archiving of the original paper prescription in the pharmacy. گاهی اوقات دادگاه قاضی اینا برگاه اوریجینال پیپر آرشیو شده رو میخواد. As a legal document. Who can write prescription? In Hungary, physician, medical doctor, veterinarian and dentists. In United Kingdom, physician, veterinarian and dentist and certain qualified nurse. Certain qualified nurse also can prescribe the medicine. It is estimated that 3.9 billion prescriptions were written in the United States in 2008. 3,000 billion per year خیلی ها. In the United States, medical practitioners, sloppy handwriting kills more than 7,000 people annually. به خاطر دست خطاشون. Sloppy handwriting همین خط کرسیو. Okay? According to a July 2006 report from National Academy of Science Institute of Medicine. جالب بود نه؟
7,000 نفر ها؟ کی موردن 7,000.
Labeling of medicine. Labeling of dispensed medicine. Two main function of labeling. Identify the two main function of labeling. Two main function of labeling. Identify the content. چی توشه؟ Enable patients to use their medication the most effective way. Enable patients to use their medication the most effective way. What kind of labels are there? Pharma, industry product, factory packaged, original brand container, or repackaged for dispensing in the pharmacy. Pharmacy compounded preparation made by the pharmacist in the pharmacy. What kind of label we have? Pharma, industry product, and pharmacy compounded preparation. اونایی که خودمون درست می‌کنیم، اونایی که از کارخونه. And two main function of the labeling اینه که identify بکنه که چی تو منه و قادر بکنه مریضه که استفاده بکنه مدیکیشنش the most effective way. اینا کار labeling. Standard requirements for labeling of dispensed medicine. Information on label must be legible. Information on the label must be legible. Necessary detail. Name of prescription? No. Name of preparation? Quantity, dose, milliliter, etc. Instruction for the patients. واقعا چشمت اینقدر درد میکنه؟ بلکه خیلی داری فشارش هم میدی.
موینا توشه.
چشمت خیلی قرمز شده. من بهت میگم چشماتو ببند، زبونتو دهنت بچرخ. با حرکت زبان ماهیچه‌های چشم حرکت میکنه، هر چی باشه میاد بیرون.
نه چیزی نیستش، حساس شد. ای فکر میکنم مو توشه.
فکر نکن پلاسبوه.
دست من کسی به دست میزنن تو مو، اگه مو دستم باشه واقعا مو میره تو دست.
اصلا مو هم بره تو چشم خودش میاد بیرون. اصلا چیزی نداره که بخوای بهش فکر بکنی. تو الان الکی حساس شدی به خاطر فشار و مالوندن چشات هی داره سرخ میشه. اینقدر سرخ نبود 2 دقیقه پیش.
من اینجوری یه چیزی دیدم تو این چشم.
اصلا همچه چیزی نیست. رو موجت یه چیزی هست. خب خودت حساس شدی. چرا رو موجای من نمیره؟ موجای من که از تو خیلی بلندتره که. اصلا ناراحت دیگه خونه من نیا. دیگه خونه من نیا. خونه من سگ داره.
کشلشون کردم.
اله قربونش برم. اله قربونش برم. خب ما اینجوری سرش اینجوری میکنه. Necessary details. Necessary details should be on the label. Name of the preparation, quantity, dose and milliliter, instruction for the patients. How should you use it? Patient's name, date of dispensing, name and address of the pharmacy, storage. How could you storage? In the cool place, in refrigerator, not in refrigerator. Batch number. Batch number is a number that refers to the stock solution or stock vehicle that is in the pharmacy. And expiry date. Expiry date, batch number, storage, name, address of the pharmacy, date of dispensing, patient's name, instruction for the patient, quantity and name of the preparation. Labeling for topical or systemic use in Hungary. In Hungary, each medication manufactured in a community pharmacy is labeled with different color according to its use. Red is for external and topical use like a cream, ointment, nasal drops, etc. And blue is for internal and systemic use, syrups, tablets, suppository, etc. Okay? Emulsion paraffin, cum phenolphthalein. According to Fono, the address of the pharmacy, Felhaznalhato is the name of the patients, and here is a date of the manufacture, then date of the compounding, and this expiry date and signature. Signature is here, and date of the expiry should be here. Here is not the expiry, it's a signature of us. Ungumentum emulsifying non-ionicum هم که یادش بخیر. کولشولک بود externally use. کولشولک به بلوشک میشه internal، کولوشک میشد external. Information. No patients should leave the pharmacy without knowing how much, how often, and how to use his or her medication. None of the patients should leave the pharmacy without knowing how much, how often, and how to use his or her medication. The prescriber instructions should be translated into an appropriate form and language, giving information and instruction. Writing, it means labeling, and orally by counseling we should transfer the information, we should communicate to the patients. Written and orally by labeling and counseling. Latin term and abbreviation. Use of Latin terms persists in prescribing around the world. The knowledge of the following terms and abbreviation is essential for everyday work. Dosage form. Capsula, caps, capsule. Kirimor, cream. Gutae, gut, drops. Oculentum, oculent, eye ointment. Pasta, past, paste. Pulvis, pulv, powder. Ungumentum, ointment. Term used in foreign prescription in US and UK. In US and in UK they use AC. Latin term is antecibum. It means before food. Antecibum means before food. BID or BD means bis in D. It means twice daily. PC, postsibum, after food. PRN, perorenata, when required. OD, omni-D, every day. QID, quarter in D, 4 times daily. SS, semis, half. TID, ter in D, 3 times daily. که خیلی مهمه اینا. تو امتحان هم میاد. Roman symbols and the corresponding Latin. Unum, unus, duo, tris, quator, quinque, sex, septum, octo, novem, decem, unidecem, duodecem, tridecem, quattrodecem, quindecem, sedicem, septemdecim, dode viginti, une deviginti, viginti, triginta, quadraginta, quinquaginta, sexaginta, septaginta, octaginta, nonaginta, centum, mille که همه رو باید بحشن. میله امه، سنتوم 130، بعد 50 میشه ال با ایکس میشه 50 تا 10 تا 60 تا مثلا، اینجوری که همه رو بلد باشیم. بای بای.